Rachel Blueblond-Langner and Cecelia Gentili. Welcome to iWay.
Thank you for having us.
No, thank you so much for being here. I wanted to talk to both of you today because we are doing a mini-series on silicone. And Rachel, you are a surgeon, specifically within gender-affirming surgeries. And Cecelia, you are an activist. In fact, you have your own company, which is Transgender Equity Consulting.
Yes.
And so as two people who deal with this on a day-to-day basis, I feel like you're the perfect people to talk to. And Rachel, I think you've had quite a lot of experience with the discussion around silicone, which is something that I know so many young people have to access, and perhaps less so in New York because of the fact that now, especially since 2015, it's been available on Medicaid and within the healthcare system. But even still, some people across America, so many young people across America don't have access to that, or they can't afford healthcare. And so for those young people, I really want to discuss the dangers of using loose silicone.
Yeah.
And so I wanted to ask you why you are so against people using loose silicone for gender affirmation or just for general reconstructive purposes.
So there are two reasons. One is that a board-certified surgeon is not injecting the material, and so there are very delicate structures, arteries, nerves that can be damaged or injured during the process of injection. And then the second thing is that it's not medical grade. It's generally, it may have been sterilized, but it's not a medical grade product that is injected. There are alternative procedures that are safer and actually more durable. So facial feminization, where we actually change the bone structure or inject the patient's own fat. Breast augmentation, where we put in FDA-approved medical devices in a sterile fashion for breast augmentation.
Yeah, I had my first experiences with silicone at age, I think 19, and it was a birthday present of a friend that I invited to my birthday party, and she got to the party late. The party was gone, so everybody was drunk and high. You know, it was the 90s. Not that people don't get drunk and high now, right? But at the time, that was the norm, right? We're very high and very drunk. And she got there around 6 a.m. with the bottle like this, and she says, "Happy birthday!" And I'm like, "What is this?" And she's like, "I'm gonna give you a liter of silicone as your present." And they laid me on the table where we had dinner, and they shot silicone there in my butt.
While you were
high and drunk, and yeah.
Okay, and
which tells you a lot about like ideas of risk, right? I think like as a trans woman of color who, you know, usually like it is said that the life expectancy of a trans woman of color is between 32 and 35 years old. So, you know, I never envisioned like or saw myself with the future. So I took like different risks that maybe a cis woman or a white woman wouldn't take.
Certainly that is an extreme story, but also there are just people in the middle of the day practicing in their basements who are not medical professionals all over the world. And because iWay has an audience all over the world, we're telling those stories for people outside of New York where they are more tolerant and more careful. And I would love to understand from you the specific dangers of using loose silicone.
When you inject something that is not your own, so it's not your own tissue, it doesn't have its own blood supply, so it can't fight infection the way your own body can. And you're injecting it in a non-sterile fashion. So you are further increasing the risk of infection. So I think the number one issue with silicone injection is infection. The second is that the injectors don't necessarily know the anatomy, and so it can be injected into blood vessels, it can be injected into nerves, it can be injected so close to the skin that it kills the blood supply to the skin and then damages the skin. It can be injected deep into muscle, and then it can form lumps, it can become painful. And it's also injected in a way that it's these tiny little particles that are injected throughout. It's almost like buckshot. that when it goes off, it's lots of little pebbles everywhere. So when we go to remove it, it's not like removing a silicone implant where you remove the implant and everything's out. It's really difficult to remove all these tiny little particles. And even one little particle left behind, if that is still infected, can continue to infect and cause problems in that area.
How serious are these problems?
They can lead to death because it can be an infection that you can't treat. We do major reconstructive operations, so I think we've seen the very, very worst and the very horrific stories of silicone injections that have gone poorly. People spending months and months in the hospital having multiple debridements, meaning removal of tissue, so that there's basically no soft tissue left on the buttock. And then having to do massive reconstruction later, and still coming back, months later with infections that require IV antibiotics, further surgery. We have one patient now that's had 40 surgeries.
40?
To try to remove it, because you can't get every little piece out.
Yeah, and there's only so much that antibiotics can do after a certain amount of time.
It becomes a little nidus for infection. So those are the real horrors of it. And there can be death. I mean, if you inject the silicone into an artery or a vein, you can kill somebody instantly.
And also can travel without causing those problems, but really making the body look not as you would expect and plan. Like, in my case, I have silicone and, I didn't have medical issues. I didn't have an infection or anything, but it definitely, it traveled. Some of that silicone traveled to places that are not causing me a problem or pain in a way.
You don't like the way it
but
looks?
I don't like the way it looks.
Right.
Like, so if I'm going to wear a bikini, I think twice, and I may wear shorts, right? Because, it's parts that I don't feel comfortable, right?
Yeah. And so when we talk about silicone implants, that's a very different thing.
Correct.
Because someone watching this might now just think the word silicone attached to anything is deadly.
Yeah, no. So silicone as an implant comes almost as a bag, right? It's a bag
A very
contained,
protected sac.
It's been prepared in a very sterile environment with prescribed formulation. And Cecelia, maybe you can share what silicone is like when it's freely injected. It's similar to basically what you caulk tubs with. Right?
I don't know how to describe it. It is like a very clear white substance, and that's what it was put into me. And I never shared this with anybody. I actually I play someone that put silicone in the girls in pose. My character is the one that does silicone. But I actually did put silicone in a person in the 80s. It was a friend of mine that was dying of AIDS, and it was losing so much weight, and they wanted to look healthier. So as they were losing weight, people were injecting silicone to make them look bigger. It was like really crazy story. So yeah.
Comes from a very humane place, though.
Yeah.
And I think all of these, it's never done with malice.
No, and it's not done with malice. And like for some of us, I know that now we have alternatives, but at the time when I had silicone, it was no alternatives. Being able to have a curvy body, it was really reaffirming for me as a woman. I remember the first time that I saw myself in the mirror after I got the silicone injections. It was like, I arrived.
It was so interesting what you said about the risks that, in particular, transgender women of colour might take because they don't expect their life to be so long. And I hope that this is the generation that will change that statistic and change that mind setting in young trans people, especially young trans people of colour. I hope other young people can look to you as an inspiration. And also, you're now bloody acting in Pose. Look at how your life turned out. So thank you for the work that you do. Thank you both for being here to help us warn everyone.
Thank you for having us.
Thank you.